We'll talk about another type of ectopic pregnancy. Now, some people use the names interchangeably, while some people actually can say Cornual and Angular pregnancy. So what this simply means is the embryo is not implanting in the endometrium, but is rather implanting high up here in this angle. Do you understand? So the angle is what we call the angular. Okay, so it just refers to rare, it's a complex type of pregnancy. This one, the embryo implants near the uterotubal junction. So where the fallopian tube is coming to join with the uterus, that's where the embryo actually implants. So we call that the uterotubal junction, especially in the lateral angle of the uterine cavity. So it's often confused with interstitial ectopic pregnancy. Okay, but cornual is quite, you can just know it. So cornual pregnancy is often used interchangeably with interstitial pregnancy, but technically it's in the upper lateral uterine cavity near the cornua. Alright, angular one is a subtype of cornual. Do you understand? So it's just something that if you want to be strict, you just define them separately. If not, on a normal basis, they are often discussed together. So diagnostic features, if you want to pick it up, you do imaging. It's just like what I have here. Okay, so gestational sac located in the uterine fundus, surrounded by myometrium on sides. Okay, so it could be MRI or 3D ultrasound, just like what I have here. So issues that is considered, angular pregnancy is considered intrauterine and may progress to term. There's high risk of miscarriage, uterine rupture. Cornual or interstitial pregnancy considered ectopic often requires termination because there's a risk of rupture. Okay, so management, you monitor with ultrasound, surgical intervention once you are noticing that complications will come up. That's for angular pregnancy. Then for cornual pregnancy, where you actually need a termination, okay, definitely you can use methotrexate or surgical removals.